Welcome, everyone. Welcome to Friday. It is almost the end of May. June is almost here, and I love days where the sun is peeking out and shining. Hopefully it's shining where you are. It just brings light and energy, and we can all use that. I do have some positive information to share with you guys today, so I think I'm excited about being here with you. And I've missed you. It's been a week since I've been able to talk with you guys, and I'm just glad to be here on this Friday with you. So to start out with, as usual, I will give the case counts. In La Crosse County, at the present time, we have had no new cases today. We have a total of 53 lab confirmed cases, 47 of which have recovered. We have a total of 5,111 negative test results to date, and 0 hospitalized and 0 have passed away from COVID-19 in La Crosse County. We're doing really well, and let's keep doing really well. On the Wisconsin side, we have had a total of 17,707 cases. That is an increase from yesterday of 733. We have a total negative number of, number of negative test results at 233,588, and that is up 12,869 from yesterday. And in the hospitalized category, we have 2,499 total, and that is up 47 from yesterday. And in deaths, we have 568, and that is up 18 from yesterday. So we certainly still continue to see COVID-19 across our state and also in our area. So, you know, I do have some good news to share, but that doesn't mean the risk has gone away. So I just want to make sure we don't forget that. I want to now talk about the National Guard testing site from last Thursday. So we have a final number. We previously thought it was 304. According to the National Guard records, the total number of tests that we were able to conduct at the site last Thursday was 300. So just want you to know that there was a slight discrepancy there. The final number is 300. Of that final number, 38 were of non-La Crosse County residents, and 262 were in La Crosse County residents. In the 38 of non-La Crosse County residents, we had 0 positive test results. In the 262 in the La Crosse County residents, we had 3 positive test results, 252 negative test results, and 7 that are still pending. So at this point, I do want to recognize that the test results took longer than we had hoped to come in. I think that can be attributed to the fact that the week before Memorial Day was the same time that long-term care facilities across the state were receiving test kits to begin testing staff and residents at long-term care facilities. And we also had our site obviously planned for a week and a half or so, maybe a couple of weeks, and that happened to fall on the Thursday before that holiday weekend. They were all going to the same lab for resulting, and the lab was open all weekend, but it did take them longer than we anticipated because the volume of tests was so high. So we are sorry that that was a bit of a delay. It was disappointing to us, of course, as well. But we did our very best to make sure that we could communicate as soon as possible. The National Guard was in charge of notifying those that had negative test results, and the process is that they make 2 attempts, and if they don't reach the person in 2 attempts, they turn the list over to us, and then we make those calls. So there were about 36 of those that we got back from the National Guard. So at this point, we think we've notified everyone with the exception of those 7 that we don't have results back yet. If you don't know your test results, we would ask that you contact our department, and we will do our best to get you those results. Next, I just want to queue up what is the bulk of our media briefing today. And we have been working very hard on a a dashboard that will be basically all of the data that we're using to make decisions. I've talked a little bit about this in the past. It relates directly to our strategy. And I just want to kind of identify that when you see this dashboard, there's a lot of information on there, but it was really important for us to be able to share everything we have and be fully transparent. So the first page, we call it the landing page, and you'll see this in a second. But the landing page is basically what most people will reference. It is a very nice visual of where each of our data categories are. So those categories being epidemiology, or what the disease is doing. The second category being healthcare capacity, and the third category being public health capacity. And you may recall me talking a little bit about those categories in the past. Each of them will have a red or a green, yellow, orange, or red light. And then those roll up into an overall status light, which we have placed in a visual of a compass. So there are 4 aspects to an actual compass, all of the 4 directions. And on this compass, it represents those 4 categories of risk. So from severe risk, which is red, high risk, which is orange, moderate risk is yellow, and low risk is green. You will notice that I'm not saying no risk, because at the point where we have no risk, which probably won't be until we have a vaccine available to us and have been able to vaccinate individuals to reach that, that level of immunity across our communities that helps prevent the spread of disease. Until we reach that point, the best category we can achieve is low risk. So that is the category that is green. So again, I think there's going to be a lot of data that you'll see. It's all available to you. We don't want that to be overwhelming or confusing. And just know that that first landing page will be predominantly what most people will reference. So when you see that, just know that. I think also just to remember that these are all recommendations and advisements. There is no order. We cannot make requirements. And so we have to continue to ask all of you, including all of us, making good choices in relation to trying to prevent the spread of disease in our communities, and also preventing ourselves from getting COVID-19. And then I think that I just want you to know that the purpose of this compass and this dashboard is really for you to have the information that may be helpful for making decisions. And we hope that you will use it in that way and that it will be helpful to you. So at this point, I'm going to ask Jackie Lutz, who is the operations section chief of our incident command team, and in non-response times, she is our public health nursing manager. She has a strong data background and has been predominantly the person working on the development of the product, of course, in conjunction with a lot of our team members on the communication side and other areas. But Jackie will show us the dashboard and take us through the tabs and help us see how to utilize the dashboard to see the information that's available to us. So welcome, Jackie, for being willing to share this and take it away.
Thanks so much, Jen. As Jen mentioned, my name is Jackie Lutz. I'm the Public Health Nursing Manager and the Operations Section Chief in the COVID-19 response at the La Crosse County Health Department. I'm going to share my screen and try to give a high-level overview of Compass. You'll find it on our COVID-19 page at the La Crosse County Health Department website. And I'm just going to make it large, so hopefully you can see it. It's going to take just a second to load. So this is the landing page, and what you're going to see at the top, right front and center, this is that compass that Jen was talking about. So you'll see that there are 4 colors. Red indicates severe risk, orange indicates high risk, Yellow indicates moderate risk, and green indicates low risk. The way that we make this determination, and this is going to be updated every week on Wednesday, is by looking at data in 3 different categories. And I'm going to walk through that really at a basic level right now. So there are 3 categories that Jen had mentioned. There's epidemiology, which is really what the disease is doing. There's healthcare capacity, which is the ability of healthcare to respond to COVID-19 patients both now and in the future. And then there's public health capacity, which is our ability as a health department to quickly identify cases and their contacts to limit the spread of disease. And then the safety of public safety, healthcare, and public health to respond safely in the community. And that really thinks about personal protective equipment like masks. So I'm going to walk through the first 3 pages and then just give a really high-level overview to let people understand how to use the tool so that they can then go through it themselves. The second page is where you'll find that same compass. So this is the same compass in 2 different places. It talks about our risk. And you'll notice that underneath it, there are 2 tables. The first table, this one right here, looks at what our recommendations are for individuals and households. So in the same way that the compass has colors associated with that risk, the table is designed to have the same colors. So if we were in severe risk and it was red, you would match actions in the same colored column. Right now, because we're in high risk, which is orange, you're going to look at that orange column. And the same would be true if we were in moderate, looking at yellow, or in low risk, looking at green. This first table is for individuals. And as you go through it, you'll see that in order of priority, we are trying to help people understand how they can protect themselves, their families, and our community. So we talk about staying at home when you're ill. That's something that we recommend doing at every risk status, regardless of what's going on in the community. One of the best ways we can protect each other is if you're sick, stay home. You'll also see recommendations based on leisure travel. So this is travel for fun, physical distancing and wearing fabric face coverings when in public, which includes shopping, attending social gatherings, going to a restaurant or bar, protecting yourself in the workplace, and then receiving personal care services like going to a hair salon, getting your nails done, getting a massage that's based in a salon, things like that. So when you look up here and you identify what this week's risk status is, you can identify what the recommendations would be. And the reason that we felt it was so important to have this change on a weekly basis is because we acknowledge that the risk right now might be different than the risk in a week or in a month or in 2 months. And we want our community to be prepared to understand what their current risk is and how to change their behavior appropriately to protect themselves and those around them. Underneath the individual grid, you'll see what we consider to be higher risk travel locations. This will also be updated each week. This is probably part of a learning process. So right now, what we include on here are the places that have significantly higher risk than our own county. We do think that the state of Minnesota is among them. We tried to call out 3 of the specific Minnesota counties that we know a lot of people in our area go to. But I just wanted to note that there's a specific discussion in here about Minnesota if you have questions about that. Underneath that, you will find the specific recommendation statuses for business and establishments. So same kind of thing. If we're in an orange high risk status, businesses, long-term care community, schools, daycares, we tried to provide a really high level summary that would fit into one small box, just to get at the meat and potatoes of some of the things that we would recommend. We want to acknowledge that there's a lot of specifics in each of these areas that isn't going to be encapsulated by this one small box. This is really meant to be a high level overview so that people can have a quick reference. But if you have specific questions related to the sector that you work in, or to down here, you'll see more recommendations about recreation, shopping malls, gyms, things like that. If you have more questions about that and you work in that space, certainly reach out to us and let us know, and we can talk through the specific recommendations that are a little more detailed. And then the last page that I'm going to go over in depth is the third one. I want to warn you before I go there that it feels a little overwhelming at first, and I don't want it to be an overwhelming process. But we did want to be transparent in how all of these calculations come together. So this walks you through the process of how we think about risk. And I want to point out here that the biggest takeaway that I want people to understand is that it's not just about the number of cases we have, it's also about projecting where we think those cases might go. It's about our ability as public health professionals to respond to an increase of cases in the next 1 to 2 weeks. And it's about the capacity of our healthcare system to handle an increase in cases over the next 1 to 2 weeks. So all of these metrics are important in and of themselves. It's not just the number of cases we have right now, but it's really thinking about how can we be strategic and not just thinking about our risk right now that we know of, but in also trying to figure out what is our risk going to be over the next 1, 2, 3, 4 weeks, and trying to factor that into our decision making. So like I said before, there are 3 categories. There's epidemiology, which is what the disease is doing. There's healthcare, and there's public health. And you'll see that each of the metrics underneath there align with that category. So all these ones in blue go with epi, the ones in green go with healthcare, the ones in purple go with public health. Metric 1 is about the level of daily testing. And that's really trying to think through, are we doing enough tests on a daily basis on average to know the true level of disease? Because if we aren't testing enough people, we can't really talk yet about if we know all the people that are ill. We have had a lot of discussion about how to get at that figure, and it might change over time. But right now, we've set that in order to detect like what we think the highest level of disease could be. So based on that metric, if you hover over the light, you'll see that we're currently at 66.7% as of May 25th. That's the percentage of our daily surveillance goal that we're at. We're trying to get to 75% to be green. So we're getting there. We're closing that gap, and I'm really excited about that. Metric 2 looks at the percent of tests that are positive and if that percentage is stable. Metric 3 looks at case counts. So are we getting a whole lot more new cases, and how does that compare to 2 weeks ago? So if you hover over that light, it'll show you that over the past month, we've had 128.6% increase in the number of new cases. And that's why that is red. Metric 4 looks at doubling time. That's how long it takes for the number of cases to double. Healthcare has metrics 5 and 6, which are that hospitals are prepared for surge of patients and that currently COVID-19 patients are being cared for without crisis care. Public health looks at our abilities to receive cases within 24 hours of the test being resulted, all cases being reachable in 24 hours, and 85% of their contacts being reachable in 24 hours. That really helps us know that we're being able to identify people who are ill and all the people that might be at risk based on that first case. And then metric 10 looks at personal protective equipment like masks. You can see down here and kind of absorb how all of those things flow into these indicators. And then the third level takes those categories, epidemiology, healthcare, and public health, to identify where our current risk is. And we want to be really transparent so that everybody understands how important each of those elements are to understanding the level of risk in our community. For people who really want to understand more details about the data, each of the metrics have their own page, And when you click through them, you'll see that there are a lot of graphs and charts. So if you really looking at data, you'll be able to go in there to look at a map, to hover over it, to see the number of tests done in our region and in our county, to see where we are in terms of closing the gap with testing over time. You'll be able to go through and see some of those details if you want to. But the thing that's going to be most important for a lot of people are those first 2 pages. So a landing page that just gives us this high-level overview of where we are, and the second page, which helps people understand, based on that risk status, how they can protect themselves and others. And now I'm going to stop for questions.
So before we take questions from the media and from the public, I'll just summarize back up, and thank you, Jackie, for giving that overview. I think that was really helpful. I think these visuals will be important for all of us. And I do just want to say, you know, the pandemic is not over, though I am really grateful to see we're no longer in severe risk and we're in high risk. So that's good news. And I do think that that will get better in the next couple of weeks. So I'm hopeful in that regard as well. I think we all needed some good news. So I think that is really good news. So don't be discouraged that we're not yet in a green zone. We are making our way towards that. And I think doing the testing is really an important part. I also think it's good news that out of 300 tests, minus the 7 we don't have the test results on yet, we only had 3 positive cases. I think that's also very good news because predominantly we were testing individuals who had symptoms. So it could have been much higher. I did want to note that we are planning an additional testing event. This one will be held in downtown La Crosse, and more details will be coming, but it will be held on June 8th is our current understanding. And that will be from 11 to 5 on June 8th in downtown La Crosse. So again, more details will be coming about that, but I wanted you to know that we have requested in our planning another testing event. That is an important aspect of making sure we're at the right testing level to know what level of disease we have in our community. And we all want to be working towards less restrictions because it is very difficult to continue those good choices. So we still are in a risk zone, however, in the high risk area. But I want to point out that it does give us a little more flexibility than we had in the past. So look at that table for individual and households. What you will see is that, as I've asked before, if you are sick, it will always be asked that if you are sick, even with minimal symptoms, which would not otherwise be something that might keep us home. For example, if you just think it's a sinus infection or you think you have allergies, anything minimal, we would ask you to be staying home. In addition, I think the physical distancing piece is still really important whenever possible, and when you're out and about wearing the fabric face coverings. I do see a mix of that in our community, and I just want to remind individuals that that is a choice. In many instances, you can choose whether or not to wear fabric face coverings, but with the understanding that there are individuals who are asymptomatic carriers, especially for the first up to 5 days of having the virus. We would like to decrease the risk of spread with whatever tools we have. And one of them is when individuals wear fabric face coverings. So that is basically, if I was somebody who had been exposed and doesn't think I'm sick and I don't have any symptoms yet, but I wear a fabric face covering when I go to the gas station or when I go to the store to get my groceries, or even, if you are having a small gathering, then at least I'm protecting others from those large droplets that could expose individuals around me. So just remember, there's an important reason why we ask for those fabric face coverings. I do want to just indicate that we do plan to update this every week, and the day of the week that these updates will come is on Wednesday. So there will be another update next Wednesday to the data. We want the data to be responsive to the current level of disease and capacity of public health and healthcare. And as we update this, there will be a needle that will show the current week's status and last week's status. So that way, if it changes, you'll be able to see that very clearly. The previous week's status indicator will be a lighter shade than the current week's status. So I think that will be helpful. And then just as a reminder as well that the current recommendations now in regards to congregating with others, we still have to be cautious, but we don't have to be as restrictive. So the recommendation, especially indoors, when you're inside, I'm grateful it's nice because nice outside, because indoors there's a lot of I've read some information and done some research, and I'm seeing that is a much higher risk level because there can be, depending upon the number of people in an environment and the enclosure of that space and the air circulation, there have been studies that indicate the spread can occur based upon how airflow is happening, and especially in areas where there may be poor air circulation or a direct flow of air in one direction. So I think indoors, please exercise caution. And for that reason, we would ask you to keep that to 15 people. And outdoors, the current number is 50. So you can be with others, which is wonderful. But again, we recommend the physical distancing and the fabric face covering for the reasons I previously described. So again, these are some nice things that we can not be as restricted, and I think that's really positive. We know that you may have questions for us based upon what you've seen and heard today. We do want to be available to you, and please be willing to email us at our website or at our email address. Sorry, that is the COVID-19@lacrossecounty.org. Again, COVID-19@lacrossecounty.org. And you can also call us at 608-785-6240. Again, 785-6240. And you also can message us on Facebook. So we certainly want to be responsive to you. And I guess I just want to say thank you to everyone. All of you out there who are doing your very best. It is such a balance. We don't want you to feel guilty if you've done something or made a decision that you don't feel good about. We're doing our best all the time, and we don't want you to be disappointed that we aren't in a better place either. We're moving in the right direction, and I think that's very, very promising. So this is really good news today. Both in the fact that we didn't have a lot of positives out of our testing site, and in the fact that we have moved from a severe to a high risk stage. We're going in the right direction. So we attribute to that to all of the efforts that you guys are making. And just a shout out to my team as well, because this data portal is something we didn't get from someone else. They didn't create this for us. I think it's really an important tool that can be helpful, not just for you all, but for us and for counties around us. I think it's important to have information to know how to make good decisions. And again, transparency is really important to us at the health department. So with that, I will stop talking and ask for questions.
Hi, Jen. Marcus from News 19. So if it's 3 out of 300 positive from the National Guard, does this mean that COVID-19 is not spreading in our community? And is And why is it still then necessary to have a second round of testing?
Yeah, so the reason for the second round of testing is because access to care is an important issue for us to consider. And we know that there are individuals that may not have been able to get to the Omni Center location. We know that there are individuals that don't have access to a car, and the population base is in the city of La Crosse. So if we're doing things the right way, we need to recognize that, and we need to try to increase accessibility for important events like these testing sites. So predominantly it is because we want to make sure that we are catching everyone, especially those who may not have access. And there may have been individuals who couldn't make it that day, for example. And I think it will be important to continue testing over time. And I think that will become part of how this works. Again, this is in conjunction with our healthcare partners who are routinely doing testing in their healthcare facilities for individuals that have symptoms. And I guess I also just want to say that if someone has symptoms, even if they are mild, and we want to try to make sure that you have the opportunity to get tested. So if for some reason you're struggling to get tested and you have symptoms, know that you can contact us, and we want to try to work with you to figure that out.
Hey, Jen, Justin with WKBT. I kind of want to talk about that data portal. Sorry, foot in my mouth. And this might be either directed at you or Jack, whomever might be able to answer this, but how long has this been in the works for, and why did you want to be able to have people kind of easily access this information, or be able to have people be able to see this for themselves?
Yeah, thanks, Justin. That's an important question. This is something that was developed through a type of software system called Tableau, and that took time and energy from staff, Jackie predominantly, to learn that system. And data is really important. Data helps us make solid decisions, and that's really critical for our community members to know that we don't make decisions or recommendations without data. We think that that would be less than ideal and less than responsible as your health department expert and public health expert. So data is a big part of what we do, and we think that our community members, we've received a lot of questions and inquiries from all sectors, from business and schools to municipal leaders to residents. Lots of people who have asked questions that this type of product available to you all can help answer. And I think that's important because that makes sure that everyone gets the same information. And that's always our goal. But it helps us balance the response as well, because it is difficult when we have to provide individual feedback for plans. If this data, now that this data is available, that information can be easily found here. So I think there's a lot of reasons why this is really helpful. And as far as how long it's been in the works, it's been weeks that we've been working on this to build it up. It started small, of course, with what data do we have available to us? How do we organize that data? We used Prevent Epidemics, which is an important resource that many public health professionals value because it's accurate and reliable. So we used that as a model to build the categories, and we did a lot of research around the metrics and what should turn a metric green, yellow, orange, and red. And I just say that because we don't want to put out something that isn't research-based and evidence-based. That's important to us. And also just know this is an iterative process. And what I mean by that is each week we'll find new pieces that we could add or update or make easier. We've already got feedback and we encourage your feedback. I think we're working on a tool to easily pull in your feedback if you have any, so that we can make it better. And that's, I think we want it to be useful. We want it to be useful to all of you, because that's the whole purpose of sharing it, so that you have the same information that we do, and we can all make decisions on the same information, and that is a useful product to you.
So, Marcus, again, is the 3 out of 300 number evidence that COVID-19 is not spreading in the community?
Oh, sorry, Marcus, you asked me that before, and I'm not sure that I clearly answered that, so my apologies. Thanks for bringing that back forward. I think we have to be careful to say that that is evidence that it's not spreading. I think we go back to the metrics. Those metrics that we have are really solid in research. And as you heard Jackie speak about, it's not just case counts, it's also week to week, what the case numbers, how that changes over time. And, we are clearly under a 10% amount of our population, but if we increase significantly from one week to the next, especially if it's, not a decrease in rate, but an increase in the rate, not just the number of cases, that is something we watch, because a trend, an increasing trend is a sign to us to just watch and monitor and be aware of, so that we can, again, provide whatever guidance is appropriate at the time. So I don't think that 3 out of 300 means that we don't have community spread. If that's your specific question, we do have disease out there, but we are grateful that that is not a higher number. I think it's better than it could have been, and I think that's wonderful. I think our community is doing a really good job as well. Again, remember the 3 areas of our strategy, which are, number 1, to prevent the spread of disease. And that's the only tool we have to prevent the spread of disease are the recommendations, and all of our residents doing their best to follow those. Because if we weren't doing that, and could we be better at that? Sure, we could be, but we're human. And I think if we're doing our best, that goes a long way to decreasing the spread of this disease. In addition, we have to be responding quickly to the cases we get. The case number does not say anything about how many contacts there are. There can be easily 15 contacts in any case. And as we open up more and have less restrictions, that risk goes up, that the number of contacts gets bigger, and that is additional people that we need to really quickly notify to help them understand the importance of quarantining, which means staying home even though they don't feel sick and aren't symptomatic yet, to make sure they don't become symptomatic, because they could be spreading the virus. So there are a lot of layers to this, and I would not say that that means that we don't have spread, but I am grateful that number is not bigger.
Hi, Jen. I know you just mentioned the 8 recommendations that you guys made once the Supreme Court overruled the safer at home order, and that residents are following them well. Maybe they could be doing it better, but is it still enough that you guys don't feel the need to enforce your own order?
Yeah, Haley, thank you for that question. Correct. We do not intend to enforce an order at this point. I think we're doing a really good job. Again, exposures, the safer at home order was just, I think, 2 weeks ago now. So about now would be the time that if there was a great change in terms of how the recommendations were being followed, if we had a lot of release of that and disease was allowed to spread, we would just be beginning to see some of that. So we do need to be vigilant and be watching. But I know a lot of people out there are doing the right thing, and I'm, it doesn't take 100%, thankfully, but it does take a majority. And, I just can keep doing what you're doing because clearly it's working. And I think, just to point out, the most critical areas of risk as we make decisions every day are making sure that if you have any symptoms at all, that you are not going out. We don't want you thinking it's okay to be at a restaurant when you have when you have symptoms. I mean, we can't be doing that. Hopefully it's not COVID-19, but it very well could be. And without being tested, you won't know for sure. So I think it's really important to stay home if you have any symptoms at all. In addition, I think, the face coverings in public go a long way to preventing the spread of disease. And, I think also just being wary about the cautions you take with the physical distancing and the face coverings when you're in smaller gatherings, especially when they're indoors. If you can have those smaller gatherings outside, the risk level goes down because the open air, the inability for the droplets to float as far. There's a lot of research about the discrepancy between indoors and outdoors when it comes to disease and this virus's ability to travel when it's released in whatever form, either it be a sneeze or singing or coughing or talking. So just know that that does decrease risk. It doesn't take the risk away entirely though, which is why we continue to recommend the face coverings and the physical distancing wherever possible. Also think about things like bathrooms, shared spaces, even if you are outdoors, if everyone's using the same indoor restroom, that can be something that could spread disease. So those are the kinds of things that we want to try to help you understand where the risk levels are higher so you can avoid those types of risks and keep the risk down. It's really a balance of the risks and trying to remove as many of those as you can.
So based on the data that you have now, what is our current rate of increase?
So the current rate of increase, I'm going to ask Jackie to come on because she's the data gal. In terms of the percentage of positive to total, go ahead, Jackie, I'll let you answer that question.
So that one metric that looks at percent change in the number of new cases compares the most recent 2 weeks to the 2 weeks prior to that. And that has increased by 128% over that 4-week period. We do think about the new case rate, which is taking the number of new cases divided by 100,000 or divided by their population, and then expressing it as a rate, trying to make sure that it's not such few cases that we really shouldn't be thinking about it. But all of that means is we have increased in the number of new cases over the past month. And even though our risk is lower than it could have been because we've had really great compliance and good work with our community, it does mean that we do have community spread and do have cases, and it makes it even more important that we reopen in ways that are intentional and that are designed to protect people.
Hi again. 2 quick questions. One, the testing site on June 8th, is that a National Guard testing site again? And then also, as people see restaurants start to open at half capacity, if they aren't showing symptoms, are you guys okay with them going out and eating there, or do you still recommend people do curbside pickup and eat at home?
Yeah, thanks, Haley. So on your first question, yes, the testing site is a National Guard testing site. And I do want to say, I just heard today, we have been concerned about the understanding that the National Guard was going to be, their deployment orders were going to be ending towards the end of June. concerned because we need to continue community testing events, and that is a large amount of work, and our team is already, doing a lot, and so that was worrisome to us. And I just saw in the news today that the National Guard at the federal level, the deployment has been extended. So we'll look to learn more information about that. But hopefully that means that they would be allowed to continue past the June 24th deadline that was in place, because I think that's a really important resource for us to have available as one of the tools that we're using to fight this virus, which is the testing side. The second question that you had was about going to a restaurant. And when we look at the individual household table, and when we look at the aspect where it talks about visiting a restaurant or bar, and we look at the fact that we're in the high risk category, it says dine in only in restaurants that facilitate physical distance recommendations, wear face covering or fabric face covering when not eating and drinking. That's for indoors. If it's outdoors, again, dine in is okay. Either wear the fabric face covering when not eating or drinking, or do the physical distancing with the 6 feet between yourself and others. So I think, we have restaurants that are doing a really good job of opening safely. And I think with these precautions in place, you can feel safe going to a restaurant and dining in. So just know that, yes, I think that we are getting to a place where we can do that safely. It still means we need to exercise caution and take good, use good behaviors, as I've mentioned. And there may be individuals in our community who are at high risk of severe disease if they were to be exposed, that for themselves, they make the choice on their own or in conjunction with their physician that it is not the best idea yet for them to be out and about, and that's totally okay as well. So I think, yes, we are seeing a decrease in that risk. And again, moving from severe to high risk is a step in the right direction.
What's your guidance for garage sales?
Guidance for garage sales. Well, the best person to ask this question would be Carol Drury in my department. I don't know if Jackie knows the most recent guidance. There's a lot of guidance materials and documents that come out every day. And I know there was one recently, but I haven't read it in detail. In general, I think that typically, thinking through the risk level on the fly, garage sales would typically be held when the weather is decent and the garage door is open, or it's outside on the cement in front of the garage. So the fact that it is not in an enclosed space indoors decreases the risk level. In addition, I think they are typically not larger than the 50 people outdoor guideline. So I think that the guidelines would remain in, the 6 foot physical distancing and wearing a fabric face covering, including if you're the one doing the garage sale. And I think then, then it's just the recognizing that the contact surfaces might be something to be aware of, but just kind of talking through the risk levels, that's what I would say. Would you add anything to that, Jackie?
So Wisconsin DHS did recently in the last few days put out guidance on this topic, and they are discouraging people at this point from having garage sales because it could be a higher risk environment. But they did provide a couple other options for people, which is having a no contact yard or rummage sale, or posting items for sale on a virtual community page, garage sale apps, or online sales platforms. They felt like that would be a better way to handle that right now. I think that's partially because even though we haven't seen a huge jump in cases, the state of Wisconsin is currently experiencing. I mean, we went up by over 700 cases in the last 24 hours. And part of that is because we're testing more, but part of that is also because I think that there are being increasing cases with more mobility. And so at a state level, DHS has kind of discouraged rummage sales. But I think that the important piece for our community to understand is if we're going to do something, we should always do it in the safest way possible. So even if we postpone them now, if we start doing it later, we still want to keep in mind that until we have that, population level immunity, we want to reduce our risk wherever we can. So keeping that 6 feet of distance, wearing a fabric face covering, trying to disinfect items that you get from somebody else's home, all of those kind of things, not going out when you're ill, not having a garage sale when you're ill. Those kind of things are what's going to protect our community now and in the future. And that's going to be an important part of all of our actions moving forward.
Yeah, thanks, Jackie. So I'll stand by what I said, understanding that there is guidance and you might see this discrepancy in guidance. That's the reason why we're using local data. And I would say whenever possible, follow the guidance on the tables. I think there are ways to reduce that risk. Does that mean, we go gung-ho with garage sales? Probably not. But it doesn't mean that it can't be done safely. So I think it's really a balance, as is everything. And I think it can be done safely. And again, the physical distancing, the fabric face coverings, and keeping it open and not in an enclosed space. And just recognizing that the risk level may be higher than you realize, especially in other areas of the state and in other states. So I think I've said before, but I'm most worried about travel. We don't have a lot of disease here. We have some, and the risk is here, but it could be a lot worse. We could have a lot more cases. And as we see the state and the nation open up and people wanting to travel for the summer to take vacations, we just have to be careful to do that in the right way to keep risk down for exposing ourselves and then bringing it back to our communities without meaning to. So I think the travel aspect is really important in that question as well.
I'm not seeing any other questions today, Jen.
Well, thank you guys so much. Again, such great questions from our media partners. We hope that this tool will be useful to you. We are looking to have a way for you to provide feedback to us. We just thank you for all that you're doing to help keep the risk moving in the right direction and continue doing that. It is working. We're seeing it move the needle, literally. So we're coming into a nice weekend. Get outside, enjoy the weather, get some physical activity. That's important for our mental health as well. Because we know that this isn't something that goes away next week. So we have to balance as we move through it. So thank you all very much, and we'll see you again next week.